a day after the president announced that the country is experiencing a second wave of COVID-19 cases, the Gift of the Givers announced that they would intensify their operations. I'm Karinda Jagmhan and I'm in the organization's warehouse in Pietermaritzburg, where they've been packing up relief aid that's going to be sent out across the country. And in the midst of all of this, we're going to be speaking to the organization's founder and director, Dr Imtiaz Sooliman, about the work that he's done, as well as the humanitarian ideals that he's learned along the way. Dr. Sooliman, thank you so much for speaking to Newzroom Afrika.
It's a pleasure. Thank you very much.
Absolutely. So to go back to the origins of Gift of the Givers, it's the 6th of August 1992. It's a Thursday night at 10 p.m. and you find yourself in front of a spiritual leader who's giving you a spiritual message in a language you don't understand. Tell us about how this all came to be and what
happened. In 91 it happened. I went to Turkey, met a spiritual teacher. My wife was with me. And we fell in love with what we saw. The following year, in 92, August, I was there again. It was a Thursday night at 10 p.m., the 6th of August. After a prayer session, the teacher looks me in the eye from the corner of the room. And he says in fluent Turkish, and I don't understand a word of Turkish. And he says to me, my son, I'm not asking you. I'm instructing you to form an organization. The name in Arabic will be Waqful Waqifin. Translated, it means Gift of the Givers. You will serve all people of all races, of all religions, of all colors, of all classes, of all cultures, of any geographical location and of any political affiliation. But you will serve them unconditionally. You will not expect anything in return, not even a thank you. Serve people with love, kindness, compassion and mercy. And remember, the dignity of man is foremost. So if someone is down in the ground, don't push them down further. Hold them, elevate them, lift them. Wipe the tear of a grieving child. Caress the head of an orphan. Say words of good counsel to a widow. These things are free. They don't cost anything. Clothe the naked, feed the hungry, and provide water to the thirsty. And in everything that you do, be the best at what you do. Not because of ego, but because you're dealing with human dignity, human emotion, and human life. He went on to say in Arabic, Khairun nas ma yanfa'un nas. Best among people are those who benefit mankind. He said, my emphasis is on the word mankind, not Muslim, not Indian, not black, not white, not Arab. Mankind unconditionally. Okay, we went on to say next, this is an instruction for you for the rest of your life. And that was 28 years ago. And then finally he said, what I'm telling you now is the most important of everything that I've just told you. That whatever is done through you and not by you. This is a spiritual thing. I have no control over it. As long as you remember it's done through you, no place for ego, and it's not done by you. I told you, I don't speak a word of Turkish. I understood every single word that he said. And yet if anybody else speaks to me in Turkish, I can't understand what they're saying. And I asked him at some point, I said, how is it when you speak Turkish, I understand, and when somebody else speaks Turkish, I don't understand? He said, my son, when the hearts connect and the souls connect, the words become understandable. I said, okay, you gave me this instruction. What does it mean? What must I do Sunday? I've got 3 practices. I'm a doctor in private practice. Do I do this in the weekends, public holidays, long weekends, school holidays, after hours? What do I do and when do I do it? What kind of specific task do you have in mind? Because in the social sector, there's so many different type of things. He only told me one line. You will know. In 28 years, I do know what to do, when to do, how to do, what to touch, what not to touch. And the prototype was set, the model was set. Immediately I walked out of there. The idea came, get involved in the civil war in Bosnia. And that told me, without a shadow of doubt, that Gift of the Givers is predominantly going to be a disaster intervention organization. That's the template. And he said, over the years, the work will get bigger. And over the years, we added 20 different categories of projects. But our primary project, our primary focus is disaster intervention.
Yeah, absolutely. And you began with that with the Bosnia War in around the same time, between 1992 and 1995. You took shipping containers full of relief aid to Bosnia, and then the idea came about to make the world's first mobile container hospitals, all of this through South African engineers. Tell me first about the pride that you had perhaps to bring South Africa's work there, and the help that you gave then the Bosnian people by creating these hospitals out of containers.
It was when I went in 92 November for the second time to Bosnia. I saw all the hospitals destroyed and realized you couldn't do building. In that case, everything was getting bombed. And by some strange coincidence, I'd seen a container facility in Newzroom in Johannesburg around the same time. And an idea came, as I said, the teacher said, you will know. An idea came, why can't we build a containerized hospital, a hospital in containers? And I went to the company that actually designed those containers that I saw in Newzroom. They had done three: a theater, an X-ray, and a sterilization container. And I spoke to them, it's effort. You see the traders on the road, effort, all the traders, they did this. And I told them, I said, Johan, the owner of the company, why can't we build a whole hospital in containers? He said, a whole hospital. I said, you've done three. What's difficult to make others? So we got the companies in, we spoke to them. If the shipping container goes in a ship and starts bumping from left to right on the ship, will the equipment get damaged? What must we do? And we called in the equipment specialists and we started engineering a plan. And we built the world's first containerized mobile hospital, a product of African engineering, a product of South African engineering in 1993, not in 2020, in 1993, a hospital that was taken, designed, developed, and taken from South Africa and developed and deployed in Europe, taken from Africa into Europe. Yeah. And normally we are always told that Africa is a begging bowl. We want things, we always want handouts, we can't do anything, we're not capable. And here we built something in Africa, taken to Europe. Of course, it made me proud because it showed the capacity and capability we as South Africans had, both in terms of healthcare expertise as well as engineering expertise.
Those hospitals eventually became one of the Bosnia's biggest hospitals in that region later on in 2005.
Well, it was the only hospital in the region from 1993 onwards for quite some time, right up to 2005. And when at that point, people then I gave them the permission that when you finish, when the war is over or there's some peacetime, you don't have to use the equipment in the container. You can take it out and put it in a conventional hospital. And in 2005, when I was invited there as a guest of the president, when me and my family went to the same place where the hospital was, and they took us to a fixed building. They said we did exactly what you told us to do. We took the equipment out of the containers and we put it in the military barracks. The military barracks became the main hospital. In the war, it was a symbol of death, and after the war, it was a symbol of life, where the hospital was placed in those barracks to serve the people, and the equipment is still there.
And today even, Gift of the Givers is the largest organization of its kind of African origin here in Africa. And you have spoken about Africa being described as a begging bowl, you said, when it goes to other countries. But for example, when you went to Pakistan in 2005, in the massive earthquake, you went there and your team refurbished a hospital that was about to be shut down in 24 hours. What was the perception of the Pakistani people, the other international teams that were there, of the South African team coming in and just taking over this operation?
When we landed in Rawalpindi. The military operations were in Rawalpindi. And the South African embassy, the first secretary, had arranged a meeting with the Pakistani government to receive us. The military then came to us. The moment we got off the plane, the generals came to us and they asked me, do you mind not going to the earthquake? And I looked at him and I said, yes. And my team looked at me and said, why did you come? I said, you don't know what this man is saying. I asked him next, okay, we're not going to the earthquake. Will you give me a hospital where we can treat the patients? He said, yes, I have a hospital in mind for you. So I said, which one? He said, the Cantonment Hospital of Rawalpindi. So again, my staff are looking a little shocked and they asked, what is this all about? As I said, listen between the lines. The man is telling you that everything in the mountain is destroyed. There's no capacity there. There's no hospitals. There's no personnel. People have died in huge numbers. Only survivors are there, but we can't treat them there. There's no electricity. There's no water. You need to move them. So there's no point actually going there. But as a backup, those people that are brought down can be taken to a hospital, but they need somebody to run that hospital. So we did two things. We said, okay, can we send emergency stabilizing teams to the mountain? They said, yes, but I don't have any helicopters. All our helicopters are busy on important missions. So we saw the American Air Force. I saw an American air officer. And I went to him, black man. I said, my brother, you're American. He said, yes. I said, you're not American. You're African. You're originally from Africa. He said, yes, I'm originally from Africa. I said, we've come from Africa too. We need some help. Can you help me with some helicopters? In 2 minutes, he said, take 3. The American Air Force gave us 3 helicopters in 2 minutes. They sent us the pilots, we loaded our teams, and they went to the mountains to stabilize the patients. Whilst they were gone to the mountains, the other team went to the cantonment hospital. And when we walked in, we got the sense of death, the smell of gangrene, people on stretchers, children on stretchers, unkempt, no disinfectant, no staff, no nursing staff, no proper bed, no proper facilities, and the smell. We went back to the military and we said, what is this? Is this an organized killing field? Will you put your mother in here? He said, what are you talking about? So he came with us. We went back to the hospital and the superintendent said, General, don't you know we are decommissioning this hospital? It's shutting down. So I told him, you guys are crazy. There's nothing wrong with this hospital. So he said, what do you mean? What can we do? I wrote down a shopping list. I said, you give me this, in 24 hours, we will show you what South Africans can do. In less than 24 hours, they brought what we asked for. A hospital that was shutting down, a South African team converted it in less than 24 hours into a 400-bed emergency facility, where we did 75 operations a day, besides everything else that we saw in terms of disaster and trauma. For that, the Pakistan President Pervez Musharraf at that time, in 2006, gave us a presidential award as the only team in Africa to do something like that in a disaster zone. And one of the things that motivated us is when we got off the plane, people from other countries, other NGOs from the northern countries saw us and said, who are you? Where are you from? We said, we're from Africa. They said, oh, these Africans again. They come to fetch free stuff. What did you come to fetch? What did you come to take? You guys only want free things. You guys got a begging bowl. You always ask for handouts. What have you guys come to fetch? We said, we haven't come to fetch anything. We came to bring service and save lives, and you will see what we can do. And when they saw what happened in 24 hours with that hospital, everybody was very silent after that.
Well, of course, that's the international outreach that Gift of the Givers had, and there's more adventures that the organization has had, especially here in South Africa. And so after the break, we're going to be speaking more to the work that the organization has done in South Africa, specifically during the time of COVID-19. We'll be back after this. Welcome back. We'll be discussing the relief aid done by the Gift of the Givers organization, founded by Dr Imtiaz Sooliman, who's been speaking to us first about the work he's done internationally. But of course, there's been an abundance of work done in South Africa. Specifically, recently, the Eastern Cape was identified as a hotspot in the second wave of COVID-19 again. And your team then descended on Makhanda at the Settlers Hospital, where you took over an isolation wing between almost 10 days, creating a 20-bed isolation wing costing 750,000 Rand. How did you do this with this amount of money?
We specialize in saving money. It's not our money, it's corporate money. And at times when it's so difficult like this, when the economy is down, the donor funding is also down. And donors want to see their money spent wisely. And we also, whether it's donor money or our money, as a religious instruction, we are told you have to look after resources carefully, that you are accountable as in the point of religion for resources that are given to you. And the more we use it better, the more people we can benefit. It's about maximum benefit for minimal money. Of course, with our history for 28 years, people know who we are, and people come and say, okay, from their side, they'll throw in something. they'll cut the labor cost, or they'll give the equipment at cost, or they'll make a 5% markup instead of a 45% markup, and they'll do what we can. And sometimes the laborers will say, don't pay me wages for the next 3 days. This is from me. Or the project manager will say, I don't want money for 4 days. This is from my side, so cut that cost. And you would find suddenly there's a willingness not only to help the organization, but in this specific incident, or in this specific incident, this case, that people I need because of COVID-19, people are dying. So let us do something from our side. We want to do good from our side. We want to get some blessing from God Almighty. We had a building team. We've got a relationship with the building team. A few months prior to that, we took a wing in Mitchells Plain Hospital in Cape Town. And in 30 days, we took an entire wing, and for 10 million rand, we refurbished an entire wing in Mitchells Plain Hospital. Of course, there it's 60 beds. It's slightly more because there were other things also to change. There was a lot of work to be done in that hospital. Right now, that hospital is full. For the second phase, that hospital is full. We need to put oxygen points. We need to put more support because the hospital is now fully functional as a COVID-19 oxygen facility. And whilst that was taking place, we then went to Settlers Hospital. I'm told they should Cape because the messages were pouring in from 40 hospitals. The virus is here, the virus is here, the casualty is full, patients are dying, people are dying in the outpatient, they're dying in their chairs, they're dying in the car, they're dying in the queues, they're dying at home, they're coming too late, we need to do something. So we went to Settlers, we took a walk around, and whilst I was walking around, I see these 2 empty, beautiful wards, like excellent in terms of public health service. And I said, why are these things lying empty? Where's the patients here? You show me outside, there's casualty, you show me stretches, but you're not using this place. It's all locked up, all completely sealed up. So the CEO tells me, this wing was set up by a private hospital some time ago. And 4 months ago they left. There was some friction between the private hospital and government. I don't know what the problem was. They left, they took the equipment, they took things off the wall, the plumbing got damaged, the oxygen got damaged, the ceiling got damaged, the lights got damaged, the electricity got damaged, the floor got damaged, lots of things got damaged. So I said, why don't you fix this? She said, we are told there's no budget. Maybe in the next financial year. I said, Corona is now. It doesn't help us in the next financial year, does it? She says, no, but there's nothing I can do. So I said, if I do it, is it okay? She said, if you can do it, it's okay. But what was really amazing about that, it took 2 minutes. Do you know red tape with government, how long it takes? Fill in this form, have a meeting, have a discussion, send it to the region, send it to the province, do this, do that. 2 minutes. I said, you sure? She said, yes. From there, we called the builders. The same team. They were there in 48 hours. They started on Saturday. The Saturday, they brought all the building material in. On Sunday, they started. They stayed in Makanda. The following Thursday, in 5 days, they handed the keys to us. They said, we just need to do the final touches. So we gave it the weekend. I flew in on Monday. And Tuesday we had the official opening. In 5 days it was done. And a 20-bed hospital, a 20-bed COVID-19 facility. But what was really good about this was the fact that the CEO gave an direct permission with no paperwork, nothing to sign. Just yes, do it. And that's what you do when it's an urgency, when it's an emergency and a disaster. By nature, those 3 things mean quick action. No long discussions, no protocol. The second great thing that happened, Dr. Tim McNally, head of Temba TB Hospital, also in Makanda, said, I will bring the beds. And he sent 15 beds. We have to put more beds in, but he brought 15 beds, what mattresses. He said, I don't need them back. They were just lying, wasted. He sent it to hospital. Inter-hospital cooperation. We supplied 120 beds and set up a 120-bed COVID-19 facility in Bishu Hospital. Now, we thought maybe we can borrow some of the beds, but no, they all now we put into the hospital. The CEO said, look, I have some stretchers, brand new, we're not using. We said, okay, we can't use them as beds. But when we were walking down this aisle, we saw there were not enough stretchers in the outpatient and the casualty. So we said, send them. So my teams went and fetched 16 stretchers, which we put in the casualty for new patients coming in. We put it in maternity and we put it in theatre. Now this brings out another point, that if you network properly, if there's urgency to help, if there is cooperation and understanding and a willingness to help, you can do a lot of things very, very quickly. So we solved a lot of problems in 5 days.
It seems like in a very short amount of time, with not using an exorbitant amount of money, the gift of the givers are able to go into situations, step in and provide relief where relief is needed. But essentially, this is where government should be stepping in to provide that assistance to the people on the ground. What is your take on having to go to areas, for example, to places like the Eastern Cape? I know just recently you visited a local village where people for years were begging for clean water, and in a matter of days, you drilled boreholes there. But this isn't a service that should be provided by the local government. What's your take on having to come and do this?
Government seriously needs to look at itself. Look, there's a lot of good people in government. It was the government actually called us to come to Pedi. And they were quite open. They said, look, we drilled 32 boreholes and we didn't get one drop of water. And the problem with that system is there's a lot of corruption. People just get anybody and give them contracts. You have to work like a corporate. Because since it's not your money, you really don't care. In the corporate, you make a mistake like that, you're out of the company. So government needs to look properly at expertise. Who can do the job best? It's not about buying a drill, and all of us can go buy the drills and start drilling everywhere. The type of contracts they give is, we allow you 10,000 meters of drilling. I'm just giving an example. It may be 4,000 meters, but 10,000 meters of drilling. What that means is, you can keep drilling up till you finish 10,000 meters, 80 year, 150 day, 200 day, 70 year. When you add up 10,000 meters, okay, I drilled for 10,000 meters, sorry, I didn't find any water. There's no obligation to find water in the contract. So you die, you get your money and you go. Who understands the rocks? Who understands what type of water comes from which type of rocks? Does this water contain salt? Does it contain iron? Does it contain manganese? Does it contain something else? Who knows that? You need people who know the rocks properly. Now that's our advantage. We've got a geologist who studied the rocks for 40 years. Dr. Imtiaz. When he goes to an area, every area he's been to, within 3 to 5 hours he's found water when people haven't found it for months. So government needs to re-look at how they give the contracts, who they give the contracts to, what type of proviso they put in the contract itself. And there has to be a better cooperation between the municipality and, in this case, the water and sanitation department. They have to have tighter measures. And to me, the most common sense is, I think everything should be controlled, funding should be controlled nationally. Because in that way, you can compare prices in 9 provinces. For the same type of rock, same type of situation, this guy told me 500,000 rand, and that guy told me 50,000 rand. Now either the 50,000 guy is taking a shortcut, or the 500,000 guy is robbing me, or it really is worth 500,000 rand for the kind of work that he's going to do. So you need to have better systems to control this kind of stuff. We already drilled 8 boreholes, all fully functional. We found 4 boreholes, we found 6 old boreholes that we blew out. 4 we can use, 2 we can't use. Now we've got to test the quality of the water. We may have to do something if the chemical is not correct. We still have to connect electricity. We put the pumps in, but people have found water. Worst case scenario, they can boil it and drink it. If you don't have any water, you can't boil anything.
But you found the water.
We found the water.
So is this the systems that you have in place for Gift of the Givers to ensure transparency? Because at the same token, you are dealing with large amounts of funds that need to be sent out to help people, and you need to ensure that those funds are not being misused.
Of course, because if corporates are at once smell that anything's been wrong, you're never going to get them again. And it's only right. They've given hard-earned money from their companies with good faith to you. You in turn have to take it in good faith, but it's not for you. It's for you to use for somebody else who's in trouble. And when you put it in good faith for those in trouble, those people enjoy or are grateful for what has been done. The municipality, it is their job, or the government entity, to make sure it runs well. In that way, we are all winners, because the corporates will say, okay, I want to give you more, and another, and it has happened. We start off with some corporates with 10,000 rand. The contributions are going to 5 million from 10,000 rand for the first time. You know, over the years, because they've seen what we do and they keep coming back.
So Dr. Sooliman, if you can just quickly also tell us, because there is not enough time in this interview to speak about all of the interventions and relief work you've done in South Africa, but the one over your past 28 years that's touched you the most in your own country, what project would that be?
COVID-19, without a doubt. It has been the project that has brought huge mental, emotional, physical distress, heartache, people dying in isolation, destroying the economy, people who are well earning, who could give, have become people who have to be recipients of aid. Companies lost jobs, lost, medical guys needing psychological assessments, needing psychiatric consults, medical personnel dying like never before in not even 1 year, in 6 or 7 months. When I say medical personnel, I mean nurses, doctors, allied staff, the porter, the guy who carries the patient on the table, the tea lady, all of them in the medical setting. So many have died, and the grief it has caused, in 1 year. Police people dying, so many of them, so many SAPS people have died because they're in the front line controlling all these things. Yeah. And when one gets sick, just 3 weeks ago, the time that I went to Eastern Cape, before I saw settlers, or immediately after I saw settlers, that was the 30th of November. On the 2nd of December, just about 35 kilometers outside Makanda, there's a place called Alexandria. We were going to do a big program for the SAPS. On the 30th of November, they called us, they asked, can we cancel the program? A brigadier and a colonel who are the main people in that program are positive, COVID-19 positive, and all the others have to go for testing now. We can't do this program. We are a risk to ourselves and we are a risk to the public. Those same 2 people passed on 4 days after that. And like that, we've lost a lot of people that we know personally. And in Livingston Hospital, the medical lady was very happy. The day we got there with all the supplies, the next day she was very depressed. And she said, we asked, what happened to you? She said the dermatologist lost his wife to COVID last night. 2 days later, she said the nurse had served here for years. She passed on, she died in a bed. She couldn't get access. She couldn't access health care for COVID-19. She gave her service as a nurse. She died in a bed in a house. It's been a year of absolute tragedy. Health point of view, medical point of view, economy point of view, and the drought in Eastern Cape running for 5 years, and the amount of animals that have died because of a lack of fodder. It's all combined in one. It's probably the worst year in our history.
It has been indeed, and of course this is perhaps the year in which the spiritual leader is speaking about what you are meant to do, and we're going to speak more about that, as well as speak about the team behind Gift of the Givers. In fact, they're out here, you say, for the first time gathering together, being able to begin or really look to the relief work for the next year. So after the break, we're going to be discussing more about the team behind Gift of the Givers and get to know a bit more about the man behind Gift of the Givers. We've been in conversation with Dr Imtiaz Sooliman, who 28 years ago founded the organization The Gift of the Givers, this on the advice of a spiritual leader. Dr Sooliman, in 1992, you were told that you need to follow this route, and you gave up then your practice here, your medical practice in Pietermaritzburg. I want to know, at that point of you choosing to undertake this path, did you have any doubt about yourself, the future, and the future of your family for giving up really that support structure that you had?
When I saw the teacher for the first time in 91, my wife was with me. And both of us fell in love with the teacher. And in 92, I came back. There was something I believed in this man. And to me, it wasn't a prompt to give it up, because he told me that you'll be looked after. He said, I'm not your biological father, but I am like your biological father and the spiritual father. And as I would worry about my own children, you are my son, I worry about you in the same way. You will be fine, everything will be taken care of. And in 28 years, everything has been taken care of. Yeah. But the strange thing was this, that in 94, it wasn't me that closed my practice, it was my wife. She said, you're running all over the world. People are coming here and they're sitting in their practice with sick children. They don't want to go to any doctor. One day somebody's going to die in your surgery because they don't want to go anywhere else. And they don't want to see the locums that you're putting in. It's costing us a lot of money and we're not achieving anything. I think you should just shut this practice down. And I thought about it. I wasn't even in the country at that time. I was out of the country. I was in Bosnia. And I looked at it and I said, she's making sense. And as the organization, and the teacher said, the organization will grow and grow and grow. And I realized that you can't do 2 professional jobs at the same time. So it was a choice of the practice or a choice of the spiritual work. But I already gave my commitment to the spiritual teacher when he said, this is an instruction for you for the rest of your life. And I accepted. So there was no option. I had to go for that. But it's not like a gun was put to my head. I was happy to do that. The person who found it very difficult to accept was my father. And he said, but you studied for 7 years. You just started practice. You wanted to specialize. Are you sure you're doing the right thing? You know, what's the security? What's the future? Where is this going to take you? How can you be so sure? I told him, Daddy, I have faith this thing is going to work out. And he was always in doubt. And he said, look, I don't have the faith that you have. I can't stop you. He passed on in 2016. But a few years from before that, he started saying, you know what, I'm happy. You made the right decision. I wish I could have the faith that you have, but I'm very proud of you. You've done the right choice.
And your other family, of course, is a support system in Gift of the Givers, your contingent of staff across the world. They're right here as well. I want to know, they go out with passion and dedication into some of the worst parts of the world where there's complete anguish. What sort of impact has this had, if any, on their own mental health as well as your own mental health? How do you overcome going into situations where people are just suffering?
There's a lot of answers to your question. Okay, the first part, the teams I have a core team of at least 30 or 40 people. They were not the core team from the first day. They developed into a core team through several missions. Now let me tell you what I do. When we're going to a war zone, I actually tell them not to come. I tell them you can die, you can get your face blown off, you can become disabled, you can get captured if it's different types of groups, you can be kidnapped, you know, a lot of things can happen to you. I spend more time discouraging them, and they keep saying, we're coming. And one day, they just got fed up with me. They said, don't you know that we are medical professionals and we are adults? We took a conscious decision. So I said, but what about your child at home? You know what the answer they gave me? We're going to do God's work. God will look after us, so we're coming. And do you know, for the war situation, the call-up list that people respond are bigger. The lists are more than in a normal natural disaster situation. More people sign up to go in a disaster situation is highly dangerous where they can die than a situation that's an earthquake or a flood or a typhoon or something like that. That's the commitment they have. And the moment they're there, whilst they're there, they want to know when they're going for the next one. Bombs fell around the hospital we were in Syria. Shooting took place in the hospital while we were working. Those same people didn't say, oh, we're never going to do this again. We came out from there. We have twice a year, once a year, meetings with the disaster teams. They want to know when is the next mission. That's the quality of people we have. Your question about how do we look at it? How do we take the suffering? You heard the thing social distancing. I teach them emotional distancing. You don't get attached to the situation or the child or anybody there. Before they leave, I tell them, when you go there, you can say, I feel sorry for the people of Syria or Congo or Niger or Sudan. You can feel sorry generally for the people. But don't say, I felt sorry for this boy and that woman and that man. The moment you do that, you are psychologically and emotionally attached. And the moment that happens, if something goes wrong, you are in serious trouble. You then go through what is called secondary traumatization. That not only the person on that side, but even you need counseling. And some of the people are affected, and the medical guys, of course, macho. We don't need psychological help. We are strong people. Everybody says that. I mean, that's how the medical field is. No medical person will ever admit they need psychological assessment or support. So what we do, every evening after day's work, we have an informal get-together. First, it's very structured. It's a feedback report of what's going on. Thereafter, it's like jokes and you take it easy. And you find a lot of people start unwinding by laughing, saying jokes. And there are some people among us where they look at them, they look like the counseling type. So they will go and talk to them quietly and give them their concerns. And there are 3 or 4 members in my team who can pick it up. They'll say, you know what, I think that guy is battling. I think this lady is battling. Or this doctor got a problem. We will take them 8 o'clock or 9 o'clock and talk to them quietly. And internally, they start sorting out the issues. And over the years, we know who can take the difficulty and who finds it more difficult. And when a new team comes, these 40 people, because I don't have time to see them. I'm involved with the logistics and the project and setting up the things. They would then groom the new people and say, look, be careful about this. This will happen, this won't happen. And in future, we're looking at taking trauma counselors, not for the victims, but for the medical teams that are going.
As well as you spoke about, you touched on the danger that many of the staff are in, many of the search and rescue teams are in, whether it be natural disaster zones or in areas like Syria where you already have hospitals set up. And I'd like to know more about the negotiations that you had to have with Al-Qaeda or when it came to negotiation for freedom for Stephen McGowan. Of course, I know there are security concerns around that, but what was that process like in terms of any intimidation on your team? What were they feeling during that obviously turbulent time?
There's 2 types here. The one what Yolande Koki, that was a direct face-to-face with Al-Qaeda. My guy in Yemen, Anas Al-Hamati, who now lives in South Africa, had to leave because of that process. He had to leave. He couldn't go back home since 2014. He lives in South Africa. He was face-to-face with them in the same room. He was in their car. He was there to fetch Yolande and bring her back. But when he came to Pierre, things went wrong. When the Americans went in, and Pierre and Luke Summers died. And they said that Anas told the Americans. And in return, Al-Qaeda shot our people that were going to fetch Pierre to bring him home. So the tribal leaders also turned against him. It was not in our hands, but a total disaster. But he was in their room face to face. But they did allow him to communicate with me as he was talking to them. And I would ask them for body language. How do they look? How do they speak? How's their voice tone? What are they saying? And at some points I would tell him, go back. And at some points I would tell him, don't ever go back. Stay away, don't meet them again. And then the negotiations start again. I say, okay, go back to meet them. So between the two of us, we were working how to do that. Magawan's case wasn't a direct contact. It was through intermediaries. Somebody that we spoke to inside Mali and Niger, and that person speaks to somebody else, who speaks to somebody else, who speaks to somebody else, who eventually speaks to Al-Qaeda. So that process was more secure, it was safer, but also you have to make sure the messaging is correct, that it doesn't get lost along the line, the messages that you're sending. And what our experience in Yemen, and because it was Al-Qaeda again the second time, we understood the systems much better. So to actually follow the system was much easier the second time around. And we did it for Johan Gustafsson and for Stephen McGowan, and right now we help get, the people, the two Italians that came out, we're actually briefing people for that, before that. And now we've been asked to help a Colombian, an American, and somebody said, get involved. And there's another South African trapped there also, which we're busy with.
I was just about to ask, are you now receiving calls from other countries as now the organization that's coming out of Africa to go and assist elsewhere in these hostile situations?
Yes, governments have called us. Governments have even met us. And they want to know the procedure, how do you do it? And we've briefed them. And governments don't come directly, except, I won't mention the names, but 1, 2, 3, 4. 4 governments outside South Africa came to us directly. They sent the ambassador or the military attaché or the intelligence guy to meet us directly, or we met them in the embassies, or they called from another country directly. Other guys do it through intermediaries. The guy said, look, I can't tell you who I represent, and I know he's representing a government. It's so clear because we've been in the business for too long now. So eventually in the end they say, yes, I was representing that government, thank you very much. So they find people calling us because they know the procedure and they know we've been very successful. We've been very successful in bringing ransom down from 12 million to 2 million kind of stuff. We don't get involved in the last part. So whether people pay or don't pay, we don't know that. Because sometimes there's an arrangement between the government and the government in the country where the people are, and then that government releases prisoners or does something else. So the final details of what eventually happens, whether money is paid or prisoners are released or there's an exchange or something, we don't know that. Because Al-Qaeda themselves tell us in the end, as an NGO, you can't get involved. This requires military, it requires government, it means taking the hostage out, handing it over to the government. You guys cannot get involved in that process.
So of course, Gift of the Givers comes in as peace movements to ultimately negotiate for this. Dr. Sooliman, we're almost at the end of our conversation. After the break, we're going to be discussing now what next for Gift of the Givers, because this pandemic is continuing. And of course, the help of relief organizations such as yours is needed now more than ever. We'll be back. Well, we've had a lengthy discussion with Gift of the Givers founder and director, Dr. Imtiaz Sooliman. And at the tail end of the conversation, we're joined by a very important guest, 5-year-old Rahma, your daughter. Hi. Hello, it's really nice to meet you. And just before we started recording, you told me that you wanted to meet someone very special for a very important reason. Can you tell me again who that person was?
Ramaphosa.
Sorry?
Ramaphosa.
Why did you want to meet Cyril Ramaphosa, Rahma?
Because he has money.
Because he has money. And what do you feel that he needs to do with his money right now?
I don't know.
Why you told me you wanted money from him? What he was help with?
I forgot.
She was COVID-19.
COVID-19. Yeah. I can see taking after your footsteps, your daughter as well coming through. I also want to know, what is the next step for Gift of the Givers in terms of the next year of the pandemic? COVID-19 is going to continue. What next is on the radar, possibly to get as well the President's attention?
First of all, the first part, in our 28-year history, we never planned anything. The teacher said you will know. So there's no blueprint. There's no formula. And it's been working for 28 years. Why should I change that? So we handle things as they happen. But for the COVID-19, we needed a specific strategy. And March 11th this year, I was in Cape Town 4 days before the President made the announcement of declaring it a national disaster. We laid out a blueprint for COVID-19 specifically. And we said, number one, staffing. And it's a big problem right now, as you can see that. Every time somebody gets infected or passes on or gets quarantined, it's a major burden on medical healthcare workers, especially if the counts of patients coming in starts going to the roof, which is happening right now. The second wave is far bigger than the first wave. The virus seems to be far more aggressive, and it's not targeting only old people. It's going for 15 to 19-year-olds, 30 to 40-year-olds, and even children have died. And just a few days ago, a 3-month-old baby was positive. So it's very aggressive. So we said staff. Secondly, unrestricted use of PPEs or supply of PPEs to healthcare workers or frontline workers, not necessarily doctors and nurses, everybody in those wards or in the whole hospital. Thirdly, of course, in the initial phases, testing was required because the public couldn't afford it. It was very expensive privately. So we made, from where it was 1,450 Rand a test, we brought the price down to 650. Using our influence with laboratories, we set up 10 testing sites in the country. We had 3 mobile sites. We were involved with 5 laboratories, and the price dropped from 1,450 Rand to 650, and other laboratories had to bring the prices down to around 850. So testing was important. Then, of course, the critical thing, which everybody is anxious of, the PPEs. We had to make sure that we supplied all the hospitals. We supplied 200 hospitals and clinics with PPEs in the country, and we're still doing it at the hotspot areas. Not all 200, but where the hotspots are. And then in the beginning we said, we know they're going to need tents, because they're going to say they don't want the patients to come into the hospital. The whole hospital will get infected. So selected hospitals called us, and we put up 37 tents at a cost of 3 million Rand a month. Then we knew they were going to ask us for video laryngoscopes to do the intubation. And there were only 15 available in the country. And we bought them off. And we gave it to various hospitals. And then the next phase would be, of course, if the disease gets very, very critical, oxygen points, oxygen machines, oxygen consumables, and everything related to oxygen would be the next phase. And of course, non-contact thermometers and pulse oximeters. And believe me, when we delivered those simple things of PPEs, non-contact thermometers and pulse oximeters, which we are still doing right now, then the jubilation that you get from the medical staff is just, you can't understand 8 months later why they're still dancing when you bring that stuff, and scrubs. Because a lot of them need scrubs, the two-piece suit, they were in the wards. That's been a big hit. We just gave a contract for another 2,000 in the last 2 days. And then, of course, the high-flow machines. We've been flooded with calls right now in the last 2 days with high-flow nasal oxygen machines. They said people need oxygen. We don't have the machines. We don't have the consumables. The companies are closed. What do we do? And we're getting calls from KZN, Eastern Cape, and Western Cape for that. And then, of course, we decided to go a little further and said, look, we're not keen on field hospitals. Because field hospitals will cost a lot of money, and when you break it down, what happens? All that money is lost. So we went to Mitchell's Plain because the virus epicenter was there at some point in Cape Town. And we said, do you have some building or some ward we can, assist? They came with a whole wing, Lentaki Hospital they called it. They said, this whole wing you can have. In 30 days, we renovated it, what I mentioned in the beginning, and and made it a 60-bed facility. Right now, we've given a contract to FROX to put in another 18 oxygen points. But FROX is also overwhelmed with the amount of requests, so it's going to take another week before they can install that. Then we were asked, can you get us flow meters for oxygen? Can you get us oxygen gauges? Can you get us oxygen masks? And those requests are coming from all over. Once we did the infrastructure for Mitchell's Plain, and now especially with settlers, a lot of hospitals in Eastern Cape are saying, we need simple ablution facilities. We need shower facilities for the doctors to wash when they come out of the COVID wards. Can you help us with some furniture, a chair, an urn, a fridge, a microwave, basic things they require. So what we've rolled out, the pattern we followed, we're not changing that. As requests come, we will still follow. We're going to support, like Livingston Hospital, with 26 paramedics. We already gave them 6 nurses earlier in the year. Where we can in other places, if we can support, Mitchell's Plain called yesterday. They said we will put locum nurses in. Can you afford to help us to pay for it? So now more and more hospitals are coming. They want staff, they want PPEs, they want scrubs, non-contact thermometers, pulse oximeters, high-flow nasal oxygen machines, infrastructure change, fixing up ablution, oxygen points, beds and mattresses, And those are the requests, and we're just following that as best we can.
So, Doctor, right now what I'm seeing is that people need help more than ever. They need relief organizations. But I want to know, from the spiritual guidance that you are practicing on and that this organization is based on, what is it that is stopping people from going ahead and helping others, even if it's in the smallest manner? Why is it that we're not seeing as much help as we could have? For example, from just one organization, we see help with millions across the country.
Well, there's a lot of parts to your question. The one is, a lot of people want to help, but suddenly they're in a position where they need help themselves. So a lot of people can't help anymore because they've lost everything. And by the same token, earlier in the year, a man came to our office in Cape Town, and there's many such people like him. And he said, look, last year I gave you 2,500 rand. This year, I haven't had a cent of business for 3 months. My place is closed, I have no income whatsoever. But I'm going to give you 10,000 rand. 4 times the amount last year, because while I know it's difficult for me, there are people outside who are in far bigger, difficult position than myself. So I need to give you a little more. Like him, there are many people who had the same kind of sentiment. And we found this year there was a lot of people who will do like a marathon, virtual climbing of the mountain, do some boating, do some exercise thing. And a lot of groups came like that, 2,000, 5,000, 7,000. People don't have money. But they're making an effort to do something. The corporates have come, are now looking for where they can assist in the best way possible. And of course they want transparency. Our success is that everybody knows what we do. They can see the speed at which we move. And of course, we were not formed like 3-4 months ago. We have a history of 28 years. We have a reputation. We have abundant media coverage. People know what we do. So people are keen now to take their money. If they got little of it, they had much more before. But now with all the profits dropping, they only have little to give. And they want to make sure that when they give it, it's used in the right way to help alleviate the problem with COVID-19. And a lot of funding has been, I think, even taken away from other organizations to come to us. That's the impression I get. I may be wrong. And where people don't want to give money is if they are disappointed. If they find they've done something and somebody let them down, you will find that they won't want to put money again by those people, and they get disillusioned. And it takes very long time to get people to support, especially if they've got hard-earned money and their heart is broken and they see it's wasted, they're not going to give money out. That's right. Today, I was having a discussion with my staff. I said, as part of our work, we have a responsibility, we have to be accountable, and people have to see that the money is well used so we don't break their heart. And we do the things the right way, more people will come forward. And it's not about big money. You don't need 1 million rand or 5 million rand, 50 rand, 10 rand, 30 rand. It's about volume. 10 million people, at 30 rand is 300 million.
So now, for example, when people want to help, you back in 1992 were able to shut down your medical practice on the advice of your wife and go ahead to Bosnia and fulfill that calling that you had. Now when someone wants to do something, what is the one piece of advice you have for them, whether it be an adult who wants to share some of their money to help others, or a child who wants to meet the president to make a change? What advice do you have for them?
In terms of a child wanting to meet the president, let's do the second part first. You know what? You're very fortunate if something like that happens. People have written to the president, and probably 1 million people have written, and one of that 1 million letters gets taken out. So yes, through organizations, through ministers, through diplomatic people, through people who want influence, you can send a letter, and you're lucky, you'll get called. And sometimes the president is walking through some area, visiting an area, and somebody runs out, and he will just suddenly say, okay, I'll check you out. That's totally by chance. It's a lucky packet, as you call it. In terms of people wanting to spend money, they want to do it themselves. It's important to note that sometimes that can cause a bigger problem. Because you're going to an area, you decided, he decided, she decided, they all decided they want to go to the same area, and all the people go to the same place. Now through organizations, we have records, we know which area in a specific district got and which district didn't get. And because we have so much of influence and because we have a footprint virtually in the entire country, we know exactly how to use your money. And with your money, us can get much more value because when we buy in bulk, we have an influence, we can buy things at a much cheaper price. That's on the one side. But on the other side, yes, you can still do it yourself. And where you can do it yourself is in your own neighborhood. Because you may know of a friend or a family member or somebody in the next street that because of COVID-19 lost their job. And it'll be such a blessing that in a very dignified manner, you go to my friend across the road and say, you know what, I know you're battling. I know kids haven't eaten anything. It's not a shame. You know, it's COVID-19, it's not in your control. You don't bring the virus upon yourself. Here's something, I brought you either a voucher or some food parcel or some money, and you can buy for you and your family what you need. In that case, in fact, I encourage that, where people don't have to give the money to us. Go to people in your area and start off with your own family. It may be your sister's child. It may be, and the religion tells you, have kin first, kith and kin first, then the neighbor and the orphans and the old people. So do that. If you want to do it yourself, please go and do it and encourage it right now, because you won't believe it. The amount of people that you think are okay are in a really, really bad position right now.
Thank you so much for your time, to take your time to speak to Newzroom Afrika. It's a hustle and bustle here in Pietermaritzburg at this warehouse, where of course you're getting ready to send out those relief packs across the country and continue this work into the new year. And of course, Dr Imtiaz Sooliman's final message, the founder and director of the Gift of the Givers, is to help people unconditionally. For Newzroom Afrika on channel 405, I'm Karinda Jagmhan in Pietermaritzburg.